Hi, everyone. I'm sorry I can't be there in person with you, but I'd like to go over a little bit about our poster related to building the OHDSI Evidence Network and share a little bit around how we've grown over the past year. I do want to give a big thank you to Hanieh at Johns Hopkins for helping pull these slides together. So here is our poster that won. Just to give you a quick overview, as you can see here, really our main takeaway and what we wanted to share was that the way that we've put this evidence network together demonstrates that open, federated, community-led research is inclusive and effective on a global scale. So if, in case you're new here, the OHDSI Evidence Network is a resource comprised of summary statistics of databases within the OHDSI network itself. Really what we've done is we have formalized this network of databases of data partners that contribute within OHDSI. And the way that we formalize that is collecting these summary statistics to help us identify databases that are potentially fit to answer specific study questions. And by doing that, we're able to act kind of as a matchmaker between our collaborators who have questions and our collaborators who have data. So in the way that we're doing this, it is fully federated so that patient level data does not leave the site, and we are fully in compliance with each site's privacy, IRB, and governance regulations. Now, this type of evidence network that we are building is facilitating multi-center collaboration. And you can see here, these are some statistics around publications that the OHDSI community has been able to put forward over the past few years. And we are really hoping that the evidence network will continue to contribute and increase the amount of publications that we can showcase in high impact journals. And one thing we've really seen over the past couple years as we've been building the evidence network is that bringing these data partners together, as well as study leads and clinical experts, is really helping us to forward our collaboration and really live the OHDSI mission. Now, the OHDSI network itself is really working towards that collaboration, building out research efforts to help us learn from each other. We have been having work group meetings every month to really hear what others are doing, to understand what what challenges they may be experiencing, and really offering support to each other. And we're also really working towards building out the quality and integrity of data through that learning system. So currently we are at 29 data partner organizations and 49 data sources. That's actually a little bit higher since we published our poster. We just got PedsNet included, which is fantastic. So that's definitely 30 data partner organizations. I'm not entirely sure the number of data sources at this point because PedsNet is such a fantastic network of pediatric hospitals within the US, but they have fully joined us and we are really excited to begin that collaboration. Now, as you can see here, we really have a large set of electronic health record data sources within the evidence network, around 78%. 18% is administrative claims, and we have 2% considered other, like hospital billing data. Now, over this past year, if you remember, we were working together on our guidance-driven evidence studies. And so we were able to use the evidence network to support that effort, and was really our first time going through all the steps, after collecting summary statistics from data partners, using those statistics to identify which partners, which data sources would be best to support those studies. And we really learned a lot through this effort. And it went through a couple different pieces. Like really, it was not just if your data was best fit, but which data partners were interested and had the bandwidth. That was a really big part of figuring out, which partners to align with which studies. We also investigated technological readiness. So no, not just is the data fit again, but can you run a Strategist package? Will it work in your environment? And we really actually learned a lot there as well, trying to understand how to help data partners be as ready as possible to run a study within OHDSI. And then again, we did look at study fitness, and that was really valuable to understand which data sources have the pieces necessary to actually support each individual study. And what we're trying to do there is really cut down on that thrashing time and that time that we're asking of data partners. So if we can avoid some of those upfront early feasibility steps, we're hoping to save partners time and effort and resource there, which I think we did see within the guidance-driven evidence work. So overall, we've supported 5 different studies within the OHDSI ecosystem this year. There's been a couple different ones outside of the guidance-driven evidence work as well, and we're really learning from each one. So again, here was our poster of that one, but really what I just wanted to hone in on here is that this was our really first year that we were bringing the OHDSI Evidence Network together with the full community to support community research. We've learned a whole lot around how to support partners, how to assess fitness for use, not just from a study level, but also from a technological level and a resource level. And so we're going to continue to learn and grow. We hope that this showcases the potential for the evidence network, what we are capable of, and where we want to go. So if you'd like to join, we would love to have you. We do have some information out on our website. You can see here. You can also email us at evidencenetwork@ohdsi.org, and someone will get back to you. So please let us know if you're interested and how we can help you, support more studies in the future. Thank you so much.